Hello everyone, welcome to our presentation. My name is Weiyu. I am working at National University of Singapore. I'm also the director of the Civic Tech Lab. Here I have to really thank my two great co-authors, Professor Wang from University of Kentucky and Mr. Haodong from City University of Hong Kong. They have made very significant contributions to this paper. This paper was based on a classic theory called moral foundation theory. The theory states that there are 5 moral foundations shared by all kinds of people across different societies and cultures. So the 5 foundations refer to the care or harm. Second, the fairness or cheating dimension. Third, the in-group loyalty dimension. Fourth, authority, respect dimension, and lastly, purity or sanctity dimension. So we think that all 5 foundations are very relevant in the context of COVID-19 vaccine. Let me give you a few examples. For instance, when it comes to care and harm, some people are very concerned about the harm vaccines could bring to their body. When it comes to fairness and cheating, certain issues such as vaccine distribution, especially among vulnerable groups and marginal regions, has been a significant concern. Some anti-vaccine sources have been claiming that the mandatory vaccination decision made by the authorities could violate civil liberties and shows distrust in the authorities. So this relates to the authority respect dimension of a moral foundation. Sometimes the vaccine discussions will also become politically driven and divided along party affiliations. Therefore, the discussion becomes focusing on in-group loyalty in terms of in-group identities and being loyal to a political party or a political ideology. When it comes to purity and sanctity, some anti-vaccine sources would also say that vaccines include contaminants. So everything that is unnatural or so-called impure should be avoided. So this speaks to the purity and sanctity dimension of it. Moral foundation theory, as we have seen, is very relevant in the context of COVID-19 vaccinations. So we decided to ask 3 research questions around 3 moral concepts. The first one is moral expression. Moral expression refers to how people talk about the issue using moral languages. So our first research question tries to answer that through using Facebook messages evolving over time. Our second research question focused on the sources of these moral expressions. Who are the ones talking about the issue in moral ways? So moral sources become our second question. We want to see whether the expression of moral content differs among sources. Lastly, we look at moral content as if they are a framing strategy, along with the line of framing effects. We know that messages using certain frames could have different influences on user reactions. So we ask our last research question, focusing on how the usage of moral foundations in these moral expressions might influence user reactions. But in particular, users clicking on the likes of these posts. In terms of the method, we relied on CrowdTangle. It's a data platform authorized by Facebook to examine all Facebook public pages. We used keywords in English language to search through all these public pages posts. So in terms of the time period, we started from when WHO declared that there is a pandemic. That was on March 11th, 2020, all the way to August 10th, 2021. Around that time, about 30% of the world population has received their first dose, the initial vaccination. We use the list of search keywords after validating these keywords using human coders. So our search generated 3 million Facebook public pages posts. These serves as our data set. we have two sets of independent measures. The first set of independent variable focus on the features of the pages, right? So we look at number of followers to the pages when the post was created. We also use the Facebook page categories to recode and recategorize all the pages into 7 different groups. We also look at the age of each individual post, basically how long the post has been created. So this is our first set of independent variables. Our second set of independent variables basically measures specifically the 5 moral foundations. We used the most updated moral foundation analytical tool called EMFD, Extended Moral Foundation Dictionary, to help us to automatically code the moral content contained in these Facebook posts. As you can see, we found the highest probability of expressing care in these posts, followed by fairness, loyalty, authority, and lastly, sanctity. The one dependent variable we are interested in is number of likes, basically how many times a post was liked by the readers. As similar to many of these online data, a number of likes on Facebook pages has a particular kind of distribution pattern. This kind of data distribution basically dictated us to choose one certain kind of analytical strategy, that is negative binomial regression. All right, so here are the results. So this graph shows you over time by months from March 2020 to August 2021, how the volume of the post changed over time. So as you can see that we could separate these period into roughly 3 phases. The first phase, we call it the fermentation phase, starting from March 2020, lasted into October 2020. So among these 8 months, you can see that the number of posts on COVID-19 vaccination kept at a relatively low level, with no more than 60K new posts per month. The second period, which we call the heated discussion phase, started in November. We saw a first jump in November 2020, the months in which vaccine development had significant breakthroughs. For example, on November 18, Pfizer and BioNTech announced that their vaccines have 95% effective rates. The heated discussion phase reached its first peak in December 2020. The increase in numbers of posts in that month alone was more than 300K. In this last month of 2020, the U.S. authorities approved a number of vaccinations. About 2.8 million people in the U.S. have received initial vaccination. Since December 2020, the increase in vaccine posts has kept at the rate about 300K per month. All right, we started to see the cooling down phase to emerge around June 2021. So in this month, we saw a 70K decrease in new posts. So we can see that the discussion is still ongoing, but maybe the most heated part of it has gone over. Although number of posts peaked in December 2020, you can see that average number of likes actually didn't really peak in that month. The average number of likes per post in each of the months actually peaked as early as in May 2020, 7 months earlier than COVID-19 vaccine being put into use. So what happened in that month? In that month was basically when the Trump administration made one of the first public announcements about COVID-19 vaccine collaboration with the pharmaceutical firms. This gap between peaks in number of posts versus number of likes per post is a very interesting one. It suggests that the fermentation phase although didn't have as much posts as the heated discussion phase, was already quite important in terms of shaping public perceptions regarding COVID-19 vaccinations, right? Because these posts were the ones actually captured almost 2 times more reactions from Facebook users. All right, so next, we're going to share with you some of the findings regarding sources. So as you can quickly judge from this graph, in total, media pages contributed the most posts. About 70% of all posts came from media pages. Media pages were followed by government and political entity pages, which contribute about 11% of total posts. Public figures and NGO pages contributed 9% and 3% respectively. Health, business, and other pages were all relatively much lower in terms of the number of posts they contributed. Then now I'm going to share with you some of the findings regarding how sources, right, use moral foundations in their expressions or in their discussions of COVID-19 vaccinations. Please note that the analysis are focused now on relative differences across sources, because if you look at the general patterns here, all pages actually tended to talk about care the most, fairness the second, so on and so forth. So to make a long story short, basically media pages focused on reinforcing the traditional moral values surrounding health issues such as care. Government pages, as you can expect, they focused on talking about authority, because they are authorities themselves, and loyalty values, because they represent maybe a certain national community. Health pages stood out in their relatively high rank in sanctity, but low rank in authority. All right, now I'm going to present the third research question and answers to the third research question. Basically, the influences of moral sources and moral expressions on number of likes. So the first set of independent variable refers to the sources features. As you can see, all sources features have a significant positive influence on number of likes. Number of page followers has a positive influence, but the incidental ratio here shows that the influence is not that large, it's minimum. Post ages also has positive influence on likes. You know, you can understand the older the post was created, the more likely the post was liked, right? But again, the magnitude of this influence as indicated by incident rate ratio was actually relatively modest. The set of analysis on page categories used the media as a comparison group. So all the positive effects here basically say that these other pages compared to media pages have attracted the more likes. I will highlight basically the relatively large incident rate ratio associated with 2 kinds of pages. These are non-government organizations and public figures. So the incidence ratio suggested that these 2 kinds of pages would actually on average receive about 5 to 6 times more likes compared to media pages. If you recall that media pages contribute 70% of the posts, you could understand that actually the more posts they created doesn't really translate to more attention. All right, that's basically sources influence on likes. How about the moral values? Do the moral values have an influence on likes? Well, the findings again show that 4 out of 5 moral values actually showed significant impacts on likes, right? Although again, the magnitude of the effects compared to page categories were not that high. Okay, so both care and fairness were found to have a negative effects on number of likes. In contrast, if your post talks about authority and sanctity, your post would actually have a relatively higher probability to get likes. We try to make sense of these empirical findings by drawing at least two conclusions. So first, the conclusion we made was we noticed that Facebook, right, as big or as comprehensive it looks, is a media ecology by itself. Right? So as a media ecology, as a walled garden, Facebook has its own limits. Facebook users may be seen as a fixed attention pool. This can be observed when we find that more posts do not necessarily draw more attention to the topic of COVID-19 vaccine. Right? The volume of Facebook posts doesn't correspond to the volume of likes, right? When we are thinking about this finding, we were thinking maybe one of the reasons of this so-called limited attention pool has to be related to Facebook's algorithm, right? We know that Facebook's algorithm only shows the top posts to the users. It doesn't show all posts to the users. And Facebook has its own logic of prioritizing certain kinds of content over other kinds of content, right? Recently, it prioritized user interactions over professionally produced content. This may disadvantage certain pages, such as media pages on Facebook. Within this ecosystem or the ecology, we also realize that there is a certain structure in that ecology. So Facebook has its own structure when it comes to different sources, right? We have been paying a lot of attention on news media, on government, because they are traditionally very important information sources. But our study shows that there is an emergence of so-called non-traditional information sources that might also play a significant role in disseminating information about COVID-19 vaccinations. Basically, these are public figures and NGOs. Our second general conclusion basically tries to speak to moral foundation theory. So what moral appeals or what moral frames might be particularly useful or effective in addressing vaccine controversy, right? So we found some very counterintuitive findings. For instance, expressing care and fairness is a very common practice when it comes to health issues, right? However, high amount of these moral expressions on care and fairness do not necessarily translate to a high amount of attention. So these moral values somehow actually discourage people to click likes. Maybe it's just too common, not novel enough for the users to pay very scarce attention to, right? Our results actually suggest that we should consider other rare moral values when we try to frame our messages. These values include sanctity, include authority. All right, so these are the two very initial conclusions. I thank you for your attention, and I invite you to contact us if you have any such kind of suggestions. You can find us on YouTube, the Civic Tech Lab. You can find us on Twitter, Civic Tech L. You can also find us through our website, civictechlab.org. I look forward to hearing from you.